we're going to start with injection of RHA4 for augmentation of the angle of the mandible and the jawline. We're going to turn it to the side. Again, we're going to break this into our three zones. Roughly, this is where the angle of the mandible should be. We have an area of post-jaw sulcus and a pre-jaw sulcus, mandibular attachment over here. This is the masseter, goes in this direction. Here we have the buccal zone, the masseteric zone, and the mental zone. And the significance of that being that anterior to the masseter, we have the groove, mandibular groove right about here where the facial artery ascends along with facial vein. And many a times of the marginal mandibular also comes almost in this region to the depressor angularis, etc. The buccal zone, there is really, if you go deep, you get right on the periosteum. As on the masseteric zone, you have the masseter sitting on top of the mandible. And the mental zone, we have to be cognizant of the mental foramen and some of the vasculature in that area. Go ahead and define. So we actually have a fairly nice and visible angle of the mandible. The injections should be less than 0.1 cc per injection. You can, use a retrograde injection if that's convenient to do. It's perhaps a little bit safer to do so. Here we are at the zone where it's very close to the facial artery. So we want to make sure we're subcutaneous, but not too deep over the periosteum, that's where the artery resides. You okay there?
Yep.
So we're getting a fairly good definition there. We need to bring that anteriorly. And our goal is to have a smooth transition from the angle of the mandible approaching the mentum. This was 1 cc. Even with 1 cc, we were able to get a nice enough lift. This was predetermined prior to starting our injection. So we're back to the area of pre-jaw sulcus, which covers the facial artery as well, just anterior to the masseter. Proceed to work on the area of the mandibular ligament. Forgive me for hurting you. And we want to place some inferiorly in a subcutaneous fashion. Again, the goal is to have a straight and a smooth transition between different zones. Chin down just a little bit and to the side a little bit. Thank you. I find attachments here to be a little bit more challenging to work with. The placement here is to allow better transition going and under the chin. There we go. I found in this region we have to change the depth at times so that the results are how it would seem or appear the best. May have to change depending on what the depth of the attachment of the mandibular ligament is and how easy is it to lift this area away from the underlying bony structures. There we go. You okay so far? Mm-hmm. Great. Angle of the mandible. paying attention that very small amounts, small aliquots at a time of less than 0.1 cc per injection. A lot of times this is 0.05 or 0.03 cc, which each insertion of the tip of the needle. Again, I'm cognizant of where the facial artery resides, which is very close to, a little bit anterior to where I was just injecting. Again, our challenge is going to be just at the attachment, ligamentous attachment, as we approach the mental zone of the lower face. You can actually see some bruising here. Just smooth transitions. So I'm just going over the area that has been injected to make sure our transitions are smooth all the way to anterior aspect of the mentum. There's a lot of movement, as you can see, with facial expressions that our patient has. A lot of movement around the mouth to shift the muscles and so forth. And I do like to massage the area. Currently I'm using arnica gel, but you can use any kind of a clean, sterile lubricant.